So the RMCC, it's the Regional Medical Coordination Center, 6 of them in Iowa. They're based on the Iowa Regional Medical Health Organizations. RMCC 4 covers southwest Iowa, and it collects data from both hospitals and long-term care facilities, those being things like nursing homes, rehabilitation centers, recovery centers. We have a number of data points that we collect from them daily. We organize the data that we get. We create a summary of the data. We do some data analysis on it and send it up to our state level to where they can use that to make better informed decisions and then to share across the region with needs and resources. This is important because it is an opportunity to collaborate information instead of each individual facility having to work on their own. We're kind of working together such that there is more information being shared, there's more resource availability being shared. Basically, the big thing is to allow a collaboration. So we're taking the information from all of the hospitals and long-term care facilities. Those would be nursing homes or rehabilitation centers, that kind of thing. We coordinate. We have information that we gather from them daily. We compile that. We share it to the state level at the Joint Operations Center at our state headquarters, and then they are able to share that back out to the hospitals so that all of the hospitals and long-term care facilities in the area have a common picture of resources available, such that if resources are needed in one place, that they're lacking in one place and a second place has them, it can be shared more efficiently. So when the actual resource sharing is happening through the county emergency management agencies, so if a hospital identifies a need, their first step is to call their county EMA, that's the emergency management agency, and coordinate with them. The county then puts in a request through the State Emergency Operations Center, who then contacts our Joint Operations Center, and it flows that way. So far, especially here in southwest Iowa, we are not in a critical needs situation yet. So what we're doing here is more gathering the data and using it to predict when there may be a critical need. So right now, we don't have the requirement to be doing resource sharing or patient transfer or that kind of thing. What we're doing is preparing for that here in this area. For us, it is key that we take the data that we gather and we compile that, and we are building data analytic tools that lets us kind of see where we think the next need is going to be.
We collect the data and send it to the Guard, who does the analysis, and then we collaborate together to identify if our hospitals are being overwhelmed, if they have too many patients, if they have staffing needs. We leave the emergency operations centers throughout the counties to deal with the PPE, but we're in close contact with them, so we collaborate with them to see if we can be of any assistance in that area as well. Right now, we haven't seen as much of a surge as other areas in the state has. We are in close contact with all of them. We have gotten some requests. It's mainly PPE requests, and we refer them to their county emergency managers, who are very well equipped to handle the PPE. We have seen some staffing requests, but like I said, we haven't really seen that peak surge yet. So our healthcare agencies throughout southwest Iowa are excellent at keeping us informed and following up with us. The RMCC is such a great collaboration between different agencies. The Department of Public Health really couldn't do this without them. I don't know that Iowa National Guard could do this without us. It's just great interaction and partnership that has been developed. You don't see that often, but we've been working together in such a great capacity that we've been able to move forward with this RMCC in such a short amount of time. And you normally wouldn't see that work well unless we had such a great relationship.